Hello, this is John Meisner. I'm going to be doing my CVC dressing change and saline flushes. So I've come into the room. I have introduced myself to the patient, checked both for patient identifiers, and have informed the patient that he is due to have his CVC dressing changed. Per the doctor's order, I have put the bed at a comfortable height, and I've gathered my supplies here, and I will proceed with the procedure. So I'm going to first palpate the area around the catheter site. I'm looking for any redness, swelling, edema, any pain or discomfort that the patient may be in. I'm also checking the date on the dressing to make sure that it is the proper time to be changed. Checking the suture ports or the sutures that are holding the port in as well for any redness. I do not see anything to be concerned about, so I'm going to proceed. First thing I'm going to do is I'm going to grab my mask and I'm going to put it on. At this time, I'm actually going to tell the patient to put on a mask as well. Then I'm going to take I'm going to scrub port of the first, or the hub of the first port. Take out my saline flush here. I'm going to scrub it for 15 seconds. Make sure I get all the air out of the syringe. Lower lock it on. I'll pull back just a little bit, checking for blood return. And then I would flush the lumen, looking for any infiltration of the catheter, and or asking the patient if he's in any pain or if I can see him in any discomfort at all. And then I would do the same procedure to the other side as well. Just for the sake of time, let's do that. I'll just do the one, but I would do them both. So then, before I put on my clean gloves, I'm actually just going to pull up the corners of the dressing just a little bit, just to give a good start. Just give it a good starting point. Tape here as well. Got my garbage next to me. Okay, so I kind of got that started here, and now I'm going to open my sterile supplies. Starting with the tegaderm here. Sure that I am minding the glue line of the packaging to maintain sterility. I'm not turning my back to the patient or the sterile supplies at all. Around, grab my gloves here. Open those up there. Actually, just going to move these back just a little bit. So I have some space for my throwing my gloves here on the table. Throw out some clean gloves here. And remove the rest of the dressing. I would note any drainage on the dressing, the type, amount, odor, if there's any color to it that seems out of the ordinary, and I would make a mental note of that to put on the chart. And the site looks okay. I've taken the tegaderm, or not the tegaderm, I'm taking the 2x2 off. I'm able to look at the actual site. It looks fine. I'm going to remove my non-sterile gloves, do hand hygiene, and then put on my sterile gloves. Sure that I'm keeping only touching the inside of the cuff here. Grab my other glove, my sterile hand. And I've done sterile hand, I'm just going to throw that away. I've got underneath the cuff here. I'm just going to slide in my hand. Make sure that my fingers are on the external part of the glove now, my sterile hand. That. Now I'm going to grab my ChloroPrep here. I'm going to crack it away from me and the patient, and kind of give it a little bit of shake just to get the chlorhexidine in there. And then I'm going to rub around the site pretty vigorously for 15 seconds or so, getting underneath the cords, for lack of a better term. I can't remember the exact terminology, but rubbing all around it, and then dispose of that. We'll let that dry, and I'll grab my 2x2 here, making sure to only touch one side. I'll place it over the port there, and then grab my tegaderm. Place that right on over. Grab this label off the tegaderm here. I'm going to remove my gloves, so and throw them in the trash. Make sure that looks good. And then I am going to sign and date the dressing. I'm going to discard all my items, wash my hands, and then see if the patient needs anything else, and then go document that it was done, the date and time that it was changed, how the site looked, and if there's any drainage or any abnormalities at all with the site. And that concludes my CVC dressing change.